Hi, everyone. Welcome to the Ever Living Podcast. We are your life-loving hosts, Cindy
and Jessica.
And today we have a wonderful special guest. Her name is Dr. Christina Francis. Let's welcome her.
Hello. Thank you so much for having me.
Thanks for coming on, Dr. Francis. We really appreciate it. And remind our guests, where are you from? What organization are you with?
Yeah, absolutely. So I am an OB-GYN, but also in addition to that, I am the CEO of APLOG, the American Association of Pro-Life OB-GYNs. And we are the world's largest non-sectarian professional medical organization for life-affirming medical professionals. So we've got about 8,000 members, mostly here in the US, but also some international as well. So.
That's awesome. 8,000. That's amazing. That's really great that you provide that space and that network for all those, people that hold the same beliefs and really share the value of human life. So yeah, how did you get to the place that you're in now, being the president of APLOG? How did you get into OB-GYN work? Can you tell us a little bit about yourself and your background?
Yeah, absolutely. Well, it's a kind of a windy story, I guess, because it's not, I didn't end up certainly where I thought that I would, but as is the case, I think, for many people. But when I started medical school, I had in mind that I was going to do medical missions, actually, when I finished my medical training. And so I went into med school with that mindset. And as I was thinking about what specialty I might want to do, because I knew I wanted to work on the mission field, I kind of thought I would do something very broad, like family medicine or internal medicine, pediatrics. And that all changed, though. My second year of med school, actually, I was following a family medicine physician, and he got a call while I was in his office that one of his patients who had been in labor over at the hospital was getting closer to delivery. And so he invited me to go with him while he went to do her delivery. And when I was in the delivery room, I'd never met the patient before. I didn't know who she was, anything like that. But when I saw her baby deliver, I just started crying because I thought it was like one of the most beautiful things I'd ever seen. And that should have been a clue to me that I was supposed to do OB-GYN, but there was an older sort of, seasoned labor and delivery nurse who was waiting by the baby warmer to take the baby and get baby cleaned up and all of that. And she saw me crying. And so she leaned over to me and she kind of whispered in my ear and she said, "Oh, honey, if this makes you cry, you need to do this for a living." Aww. And I know. So so many times have thought that I really wish I could go back and find her and just tell her, like, she probably didn't even think about saying that again, after she told me that. But it really changed the course of my life because it got me thinking about that. And
then I never knew how much that impacted you. That's amazing.
No, totally. And I really did feel in that moment like my specialty chose me. I don't think I chose my specialty. I think it chose me. So, and then as I progressed through medical school, nothing else really grabbed me like OB-GYN, like the challenge of taking care of two patients at once, which we're the only specialty that has that really. And, so that just very unique challenge, but also just the privilege and the honor that it is to get to be with women throughout their lifespan, really, and through so many really vulnerable, but also amazing, sometimes really sad and difficult times in their lives. And so, yeah, I definitely made the right choice. I can't imagine doing anything else. But yeah, so that's how I got into OB-GYN and also realized that it's actually a really good fit for the mission field because oftentimes in developing countries, it's women and children that suffer the most from lack of access to good care. And also you get surgical training in an OB-GYN residency. And so, that's helpful for the mission field as well. So then fast forward, I ended up going to Kenya to an amazing mission hospital in rural Kenya, where I was the only OB-GYN for just over 300,000 people. Thankfully, I didn't have to do all of those deliveries because that I would have never slept. But so I only did the complicated ones, and our nurses nurses in Kenya get midwifery training. So, and we had a school there too. So the nurses did all the routine deliveries. But I got called in for the tough ones or for the C-section, things like that. And really, really loved what I did there, loved the people that I worked with. And it still has a huge place in my heart. I was there for a total of 3 years. But in the midst of that, I came back to the States for a while to finish up my board exams and some other things, had some family health issues that came up. And during that time that I was back in the States, I got a call from my best friend who is like a sister to me and who has no trouble telling me what she thinks about anything. And
like it's your best friend.
It is your best friend. Totally. So she called me one day, and she had been activated by her pastor. It was during 40 Days for Life one year, and he had challenged them, which I always use when I'm telling this story. I always use this opportunity. If there's anybody, listening to this podcast who really just maybe doesn't have a lot of awareness, they probably do if they're listening to this podcast, have a lot of awareness about the issue of abortion. But her pastor challenged them every day for that 40 days that they needed to read or watch or listen to something about abortion, even if it was something that only took them 2 minutes to do in their day, every day, to do something that would help educate them about abortion. And I just think that's such a great challenge, because it's not that difficult. It's not that time consuming. But that was all it took for her. And it really activated her to say, I am not doing enough. And I've been, really just kind of ignoring this issue. And so she, in true Amanda fashion, doesn't do anything half-heartedly. So jumped, both feet in and really immersed herself in a lot of things related to abortion, learned really good pro-life apologetics, things like that. So she called me one day and she said, Christina, I think you need to sit down for what I'm about to tell you. And I was like, okay. And, and then she said, you're a woman, you're an OB-GYN, you're a Christian, and you say that you're pro-life, but I don't think that you're doing enough. And I think that you need to be doing more. And wow. I said, whoa, okay. Yeah, exactly.
Yeah, very honest.
Yes. I've often said everybody needs somebody in their life who will be that honest with them. And and she said, I think, I'm a Christian, I'm a believer. And she said, I think God has really uniquely positioned you to have a voice in this. And I think you need to do some of what I've been doing and start listening to some of these things and reading some more. And so she sent me, this is going to date me. She sent me a CD of some talks to listen to, but by Scott Klusendorf, who's an amazing pro-life apologist. Yeah. And she said, I really think you need to listen to this. And so I did, and it was life-changing. I mean, it was the first time, if you've ever heard Scott speak or read any of his stuff, it was the first time that I had ever heard the pro-life position defended without sort of an overtly religious defense, of the pro-life position that used reason and logic and basic philosophy and science, to defend the pro-life position and really simplify it down to the really basic argument of, abortion intentionally ends a human life. It's wrong to intentionally end a human life. Therefore, abortion is wrong. The whole argument boiled down to that syllogism. And so it was really life-changing and just began a struggle over several months of, no, I'm supposed to go back to Kenya and that's what I'm supposed to do. And eventually, there's a lot more components to the story, but eventually decided that I thought she was right. And that in fact, maybe I could have a voice, and was introduced to my predecessor at Applog, Dr. Donna Harrison, who was the previous CEO, and met with her right before I was getting ready to go back to Kenya. And so went back to Kenya for a year to sort of tie up loose ends, finish some things that I had started there, and say my goodbyes to people, and then came back to the States and in 2014, and really didn't know what that was going to look like, but got involved with Applog, joined the board, and really and truly just said, I'm now very passionate about this. I had the blessing that during that year that I went back to Kenya, Scott Klusendorf mentored me. We met via Skype every other week, and he mentored me through a long reading list that he had given me of books to read. And so that was amazing in my formation, just, within the pro-life movement. And then, just sort of made myself available and said, this is something that I'm passionate about and I'm willing to do whatever. So let's just see how I can be used. And, thought that would be working with Scott's organization, actually, which I did for a little bit, but then really became passionate and involved in trying to change the culture on the issue of abortion from within the medical community, and really seeing how the medical profession has become so pro-death in so many ways, but in particular when it comes to the issue of abortion, and realizing that medical students and residents and even physicians are being brainwashed and not being told the truth about abortion and its impact on our patients, not just our preborn patients, but on women as well. And so then the rest is history. I was board chair for a while and then took over as CEO 3 years ago. So,
awesome.
Wow.
Do we tell our viewers what APLOG stands for? Did we?
No, we can't hear Cindy.
Oh, I can hear her.
Oh, you can.
Yeah.
Okay.
Yeah. I think at the beginning, but it bears repeating again. So yes, because APLOG is a much easier way of saying our full name, which is very long. So, but it does stand for the American Association of Pro-Life Obstetricians and Gynecologists. But I think it's important for people to know too, that we represent all kinds of medical professionals, not just OB-GYN. So I always tell people that if you are involved in providing healthcare to women and you are pro-life or you want to practice life-affirming medicine, then you have a place in APLOG. So we have lots of different specialties and non-physicians that are represented in our membership as well.
Yeah. And can you say, Dr. Francis, why is it so critical to have pro-life physicians, especially even at the point where life is coming into the world? Why do we need pro-life physicians in that moment and in other fields too?
Yeah, absolutely. Well, I think first of all, the idea of intentionally harming or intentionally ending the life of any of our patients is just completely antithetical to the whole purpose of medicine in general. The purpose of medicine is health, healing, and wholeness, and abortion does exactly the opposite of that. So one, it just destroys the purpose of our profession, to think about, intentionally ending life, either at the beginning of life through abortion or at the end of life through things like euthanasia and physician-assisted suicide, things like that. So that's one thing. The other thing is that the relationship, we always say, the relationship between a patient and a physician is what we call a fiduciary relationship, meaning I, as a physician, have a fiduciary responsibility to my patient. It is a significant trust relationship. I mean, anybody knows that who's had to go find a new doctor, right? Especially women looking for a new OB-GYN, especially. That's a very, very much a trusting relationship. And it's hard. You want to know that your doctor is ethical. You want to know that your doctor is only going to recommend things that he or she thinks is beneficial to you or your child if you're pregnant. And so that's a huge trust relationship. And how can someone trust someone who is recommending intentional harm? That just completely destroys that trust. And then finally, in pregnancy, I've taken care of thousands of women with high-risk pregnancies, with pregnancy complications, with babies who maybe have an adverse diagnosis of some sort or something going on with them, that we are fighting so hard to maximize both of their health and get them at least far enough along in the pregnancy where baby can survive outside of mom. Mm-hmm. And, that's what women and families want. They want a doctor who they know is going to fight so hard for both of them. I really think what abortion has done, particularly in the field of OB-GYN, but really it stretches well beyond it. Abortion has made us lazy as a profession, actually. When your knee-jerk reaction to any thing that's going wrong with the pregnancy, whether it be baby's not developing as he or she should, or mom has a really tough, complicated complication. If your knee-jerk reaction to that every time is, well, let's just end her pregnancy, what motivation is there to come up with new treatments, new therapies, new interventions that we can do to improve those things or treat those things or maybe cure them, in some cases? We only have that motivation if we're not ending the lives of babies who suffer from those complications, or ending a pregnancy simply because mom has, a condition that is, very definitely potentially dangerous to her. But we've made so many strides in treating so many conditions, including cancers in pregnancy, that we never used to be able to do. And again, that ending those pregnancies through abortion really stifles medical innovation. So I think that's another reason why every person on the planet should want there to be pro-life doctors, because it encourages medical innovation. It encourages us to think outside the box and come up with new therapies and treatments and things like that.
Yeah. So kind of going off of that point, how do you feel about the claim that people say all the time? I feel like it has come up, since Dobbs, is that abortion is medically necessary in some cases. Do you think that is there ever a case in which abortion is medically necessary?
Well, it's a great question. And you're right. It is the kind of the thing that's thrown around a lot since Dobbs, right? Because instead of pro-abortion advocates defending their actual position, which is they want abortion through all stages of pregnancy for any reason, including if a mom just wants to abort her baby at 37 weeks, they think that should be fine. But they know that position is actually really tough to defend with the general American public. And so then what they go to are the really hard and rare cases, right? Like rape or incest or medical necessity. So this has definitely become much more of a talking point since Dobbs. It certainly was around before that, but you're right. It's much more common. Where I think we need to start with that, it's not necessarily a simple answer, because one, we have to start by saying, how are we defining abortion? And that is actually really, really important, because abortion from a medical sense is a very vague term. It means the ending of a pregnancy prior to 20 weeks for any reason and from any cause. And so that's very vague. So that's why miscarriage medically is called a spontaneous abortion, because spontaneous meaning the baby passed away on his or her own. We didn't do anything to cause it. But that is oftentimes intentionally confused with what most people understand when we're talking about abortion, which is the intentional ending of a perfectly healthy baby's life. So, and it's not just pro-lifers that are defining abortion in this way. The CDC defines abortion as an intervention that is intended to not result in a live birth. So intended to result in a dead baby, and that doesn't include miscarriage or ectopic pregnancy management. So when we ask, is it ever medically necessary to intentionally end the life of the fetal human being, that preborn human being? The answer to that question is no. Is it ever medically necessary to intervene to end a pregnancy before the baby can survive outside of the mom in order to save the mother's life? The answer to that question is yes. But that is very different than an abortion for a few reasons. One, our intent in intervening is not to end the baby's life. And you can tell that because if she's just a little bit farther along and she's at a point where the baby can survive outside of her, we deliver her, we take care of the baby, and we take care of mom. We don't need to kill the baby in order to save the mom. We do need to do what Applog calls a maternal fetal separation, meaning we're separating mom and baby because it is now too dangerous for baby to stay inside of mom. Now, sometimes we have to do that for baby's sake. So sometimes mom is perfectly fine, but baby is severely growth restricted and not getting enough blood flow. And that environment now inside of mom has become very hostile towards the baby. And so we have to do an early delivery for baby's benefit. If we don't, baby will die. Sometimes we have to do the same thing for mom's benefit. So one of kind of the classic examples of this is, let's say a woman's water breaks at 16 weeks and she develops an infection in the uterus. That is a situation in which the only treatment that will prevent sepsis, hopefully, and save her life is not only to give her antibiotics, but also we have to empty her uterus. And so we have to get the baby and the baby comes out. Actually, what we have to get out is the placenta and the membranes. Of course, there's no way to take out placenta and the membranes and leave the baby inside the uterus. And so her uterus needs to be emptied so that we can adequately treat her infection. However, when we do that, first of all, is our intent to end the baby's life? No. That's an unfortunate consequence if she's 16 weeks, but that is not our intent. And second, we do that separation in a way that respects the dignity of that baby who is pain capable, who is alive, who is a valuable human being. And so we do that through a delivery. We don't do that through a dismemberment procedure, something like that would intentionally destroy that baby. So that's very different. And, I've had pro-choice people or pro-choice doctors say, well, that's just semantics. You're just sort of mincing words here. It's not. It's more. Intent is very important, but also I know that it's not just semantics because I've heard pro-choice colleagues who think abortion is totally fine, who have gone into the room of a patient like the one I just talked about. And, she's got an infection. It's very clear that her pregnancy cannot continue or it is a true risk to her life. They don't walk into her room and say, we need to do an abortion now. They walk into her room and just like I do, they sit down with her and say, you know what, I'm really sorry. I know that you want this baby, but we don't have a choice. We need to get you delivered now. So they see the difference. It's very different. It's still very sad and it's heartbreaking and awful. And it's a horrible situation that I wish none of my patients ever had to be in, but it is very different from an abortion. And not only does this matter from sort of a policy and cultural debate standpoint, but it matters from a mental health standpoint for women as well. I think one of the biggest problems of these two things being intentionally confused in the public discussion is that then women who would have never wanted an abortion and who would feel extreme guilt over getting an abortion, and they're in this situation and they're told that this is an abortion. I've talked to women who've been in this situation. They then live for the rest of their lives, unless someone tells them differently, with guilt, thinking that there's no way they would have ever wanted an abortion, but they had one. And they need to understand it is not the same thing whatsoever. You did everything that you could for your baby, respected your baby, respected your baby's life, but you had no choice. And so, the question, is abortion ever medically necessary? I never answer that question immediately with a yes or no. Say, let's talk about how we're defining abortion. Because once we agree on that definition, then I can give you an answer to that question.
So that's very, very interesting. No, and it's definitely interesting hearing your perspective on it. Because as I shared with you earlier, I used to work for Students for Life, and I used to have these discussions on campuses all the time with students. And this was the thing that came up the most was, all these, anti-abortion laws are going to cause all these women to die. And what about in cases that are medically necessary? It was like the one talking point that definitely would come up like all the time. So what I'm curious about is, you bring up that case of that woman who never would have wanted to have the abortion. And, they're telling her that it's an abortion. So in the general medical world, is it in a case like that where a woman has to undergo a maternal fetal separation in order to, really save her life, and the intent isn't to kill the baby? What is that? Is that called a maternal fetal separation? Like in the medical world, like what is the medical term for it? What is it typically called?
Yeah. That's not currently officially a medical term. I actually think that it should become that. There's been some journal articles even talking about using the word miscarriage as a medical term as opposed to spontaneous abortion because of the mental health impact that spontaneous abortion has on women. So there is some talk around that. No, in fact, most people actually just list the procedure that's being done. So, we would say induction of labor, or we would say, medically indicated pre-viable delivery, that sort of thing. So, but the word abortion isn't used either. And I think that's the important point to point out. So APLOG advocates for starting to use the term maternal fetal separation as a medical term, again, because I think it's very descriptive. It's very specific of what's happening. But yes, if, for doctors, as we're documenting that, typically then we're saying, or let's say the baby has already passed away, then you're saying that you did a DNC or something like that. But in the situation of an induction of labor, you would use the medical diagnosis of why you're intervening. So that would be, in this instance the example that I gave, we'd call it an intraamniotic infection. So that would be her diagnosis. And then our intervention is induction of labor with a pre-viable delivery, so, yep. And so abortion doesn't come into play. The other quick thing, a little bit going back to what we were talking about just before you asked that question, that I want to point out too, is even if somebody, playing devil's advocate a little bit, even if someone wanted to define that maternal fetal separation as an abortion, it's important to point out that in every single state in this country, even in states like mine of Indiana, where we have very robust pro-life laws, where abortion is essentially illegal, those interventions are allowed when mom's life is potentially in danger. That can be done in every state in the country, regardless of how. So if someone says, well, I would define that as an abortion. Okay, you can choose to define that as an abortion. That kind of quote unquote abortion is legal in every state in the country. So there is not a single pro-life law across the country that is preventing physicians like me from intervening in situations like that where we need to, because mom's life is in danger.
Okay. Dr. Francis, can you talk about diagnoses in the womb, about that to our listeners, and how that affects pro-life? And
yeah, meaning like if mom and dad get a diagnosis for the baby?
Yes.
Yeah. So, this is a really a much more common thing now because of the availability of prenatal screening tests. So now these used to just be offered to women who were at high risk of having a baby with a genetic abnormality, or maybe they had a family history that was suggestive of high risk of a certain disease in the baby. And now, these screening tests are offered to every patient. So the reason I think that's important to point out is because now that they're being offered to low risk patients as well as high risk patients, they're actually less accurate and less predictive of an actual issue with the baby. And so that's important for people to know when you go and you get a blood test. And also many women, and I get it, I understand why women do this, but many women are like, oh, if I get that prenatal screening test, I can find out the sex of my baby at 10 weeks. And I want to know if I'm having a boy or a girl. What they're oftentimes, though, not prepared for is they get the results back that also have some kind of abnormality on them. Sometimes it's an abnormality that we don't even fully understand what it means yet. So the tests are sort of outpacing our understanding or our ability to interpret them. So that's something important to point out. But also for people to know that these are screening tests. They are not diagnostic, meaning even if you get an abnormal test result, it does not necessarily mean that your baby has one of these abnormal conditions. For most of them, the diagnostic test that then has to be done is something called an amniocentesis, where a needle is inserted into the woman's abdomen through the uterus, and amniotic fluid is withdrawn, and then the baby's chromosomes are tested from that amniotic fluid. So that is the only way to have a firm diagnosis for many of these conditions. But then I think the other important thing to bring up is there is a variety of severities, even within a single genetic condition. So for instance, something like trisomy 21, Down syndrome. Some children with Down syndrome might be very highly functional. Some children with Down syndrome might have a lot more limitations. You can't know that from the tests that we can do prenatally. I mean, even if you could, I would argue all of those children are valuable human beings who are worthy of life. But also, I think so many times when families get these diagnoses, they are just really coerced by the medical professionals that they come into contact with, who say this child is going to be a burden, the child is going to die anyways. I mean, I have heard the gamut of just horrible things that are said to families about their child's diagnosis. And I think it's important to remember that we don't know for sure what that's going to look like until the baby is born with any of these conditions. There may be a condition that has a high likelihood that the child will not live for very long. But again, we don't know for sure until we see that baby. And so I really think this is one of the biggest areas of coerced abortions that we deal with, is families feel very pressured into an abortion decision when they get one of these adverse diagnoses. And again, this is another area where when we just turn to abortion, it really stifles medical innovation. Now that more parents who get a diagnosis of trisomy 18 for their babies are choosing to have medical interventions, we're discovering, shocker, if you treat these kids just like we would treat kids with the same conditions without that genetic diagnosis, many of them actually survive and can begin to thrive. Now, they may have severe mental disabilities, but in fact, there's an amazing family that did a webinar with me for New Hampshire about trisomy 18, who has a daughter who's in her teens living with trisomy 18. So it is really, really tough. One thing I will say to point people to a great resource is a dear friend of mine, Dr. Robin Perucci, who is now a retired neonatologist in Michigan, has started something called the Fetal Concerns Clinic. And it is a hotline, a resource for parents that they can call if they've gotten a prenatal diagnosis and they want to talk to somebody who can help them understand the diagnosis better, who can help them know what questions to ask their medical team to help navigate to ensure that their child is receiving the best care possible. And so she's available to do that. She, is not in active practice anymore, but she really is there as a support for these families to say, here's what you can expect. Here are the questions to ask the next time you go see your doctor. If you get answers that you're not happy with, call me back and I'll help you. And she can even help them find, someone else potentially to go to in their area if they're not happy with the care that they're receiving. So I would encourage any family out there, and she'll talk to families in any state. So any family out there who gets an adverse prenatal diagnosis, look up Fetal Concerns Clinic, Dr. Robin Perucci. She's just an amazing support for families that are going through this, and also for physicians to be able to, refer a patient to if they've given a diagnosis like this to a patient and want that patient to have some more support.
Awesome. That's wonderful. That's definitely a really great resource. I feel like I know like a few people that could have definitely benefited from that. So yeah, it's definitely great for our listeners to know about. So I know we don't have a ton of time left, but I would love to hear a little bit more about how APLOG is changing the culture within the medical world. Just some of the work and resources that you guys have available for medical students and medical professionals.
Yeah, absolutely. Well, I'd love to talk about that because one of the best things I think that we're doing is really focusing on the next generation of medicine, the next generation of pro-life medical professionals, as we really try to forge a new path forward for medicine, to return medicine to its roots, to its Hippocratic roots that says that we will respect the lives of our patients, we will never intentionally harm them, and that we recognize the duty that we have to always put what is best for our patients ahead of everything else, ahead of, political wins, ahead of cultural wins, things like that the health of our patients comes first. And so we're really excited this year too, to focus on highlighting the beauty and the strength of life-affirming medicine, to really show the general public, okay, if you maybe think that abortion is okay, or you kind of are not happy with how medical care looks now, let's contrast what medical care looks like right now with what it could be, with what life-affirming medical care looks like. And you decide what seems better to you. And so that's what we're really focused on, is coming back to helping women understand the beauty and the benefits of pregnancy and motherhood, and understand that it isn't all scary complications and things like that. Sometimes I feel like that's all we hear about nowadays, is the scary parts and the complications and things like that. But also helping medical students, like you said, and trainees understand what is the true purpose of medicine. that health, healing, and wholeness, we need to get back to that. And so we are doing many, many things to support medical students and residents. One, this summer, we're launching our inaugural Hippocratic Academy, which is going to bring students in early in their medical training, ground them in solid Hippocratic principles, again, based on the Hippocratic Oath, that oath that really set the basis for medical ethics, teach them solid pro-life apologetics, and equip them with all of the medical evidence that shows the harms of induced abortion to women, so that then when they're going through their medical training and they're being told by their attendings that that abortion is healthcare and that abortion is essential, they're armed with the medical evidence they need to say, actually, it's really not good for my patients, and I only want to recommend what's best for my patients. We also are out there fighting for the conscience rights of medical students and residents. Right now, OB-GYN residency programs are required by the accrediting body to provide, or they're required to have abortion training as part of their required training for all residents. Now, they say that residents can opt out of that abortion training, but of course, anybody who's been in that kind of environment knows that it is extremely hard for the lowly first-year medical student or third-year medical student or first-year intern to say to the people who are going to determine the course of their careers that they don't want to do this what's considered standard training. So it's extremely coercive. And so we're working on several fronts to defend their conscience rights and to show them that this actually isn't bread and butter OB-GYN care, as the American College of OB-GYNs would like them to believe. In fact, 76 to 93% of OBs don't do abortions. And so we want them to understand that it is not consistent with the way most OBs practice, and that we want pro-life students to be going into the field of OB-GYN. So we have lots of opportunities to support them. We've got scholarships available for them to come to our national conference, and they can join AppLog for free and get full dues paying member benefit. And we have a rapidly growing and robust student and resident subsection as well, where they really are helping support one another. And the last thing I'll say too about that is part of the Hippocratic Academy is that it will be sort of a multi-year process where we develop an alumni network from within that. So they'll have ongoing support for one another as they progress through their training, and they'll have people who did it ahead of them eventually that they can reach out to get advice about particular training programs and things like that. So we're really excited about the Hippocratic Academy and excited about our first launch of it this June.
That's wonderful. You guys are doing such great work. And yeah, that's like, wow, that stat, 76 to 93% of OB-GYNs don't do abortions. And the fact that it's a required part of medical training is crazy. And I know I was telling you in the beginning, I was going to, if you didn't elaborate on the opting out part, I was going to ask about that, because the OB-GYN student that I met recently, she was telling me about how she's like, oh, people can opt out of it. But yeah, that is a really valid point of like, everyone else is doing it, and everyone who's going to be able to, is determining essentially your future in your career and profession is telling you should do this. It's hard to stand up for your rights. And
yeah, absolutely. Well, and we, the other important thing about ensuring that we have at least OB-GYNs who are not pushing abortion on patients and being taught how to adequately counsel patients is that women need to know that they have support. And when all we do is give them the number to the local abortion clinic when they start questioning whether or not they can handle being pregnant, we need doctors who are trained in how to have those conversations. And honestly, the only training people get in their medical training is if a woman even hints that she wants an abortion, you are basically to keep your mouth shut, other than to say, okay, here you go. Here's the referral to the abortionist. Or if you're doing abortions, to then go ahead and do an abortion. And so, one of the things that we're equipping our students with too is how do you have that conversation with the patient? No, you're not forcing your will upon them, but how do you have that conversation? And, the easiest way to start with that is just to say, this is what I say to patients. Can you tell me what it is that makes you think that abortion is the best option for you? Because just in asking her that, oftentimes you'll hear, well, I just need support and I don't have it. Well, then why don't we get her the support that she needs? So I think the best response in that situation is, you've got this. In fact, we'll make sure that you've got the support you need. And we have so many resources who can help you. Or let's try and identify somebody in your family who can come alongside of you and support you. Or if she doesn't have anyone, let's get her connected to her local pregnancy center who will walk through that with her. So there's so many good things that can come out of that conversation. And we know that the majority of women who choose abortion actually say that they would have chosen life for their child and to parent had they had the support that they needed. And to me, there isn't anything worse than thinking that women are making the choice to end the life of their children simply because they feel like they don't have the support that they need. That's such a simple thing that we could do to empower women and to impact, obviously save their child's life. So those are the kind of things that need to be taught in medical school and medical training that aren't, that APLOG is really stepping in to fill the gap on that.
That's amazing. That's great. Well, Doctor, I know you have to hop off soon, so we don't want to keep you much longer, but how can people follow your work? How can, do you guys have social media? Do you have a website that both our listeners and maybe any med students or pro-life medical professionals can go to?
Yeah, absolutely. So the easiest place to start is just our main website, which is aplog.org. So that's aaplog.org. You can go there to join, to find more of our resources. We have practice guidelines, so practice guidance that's all evidence-based for any medical professionals who are interested in that under our resources tab. All of our events, trainings, all of that are available on there. We do have extra content available for dues-paying members. And again, any medical professional can join, as well as we have organizational memberships. So we have lots of pregnancy resource centers that are organizational members of APLOG. And if you're dues-paying members, then you get access to our medical education videos. The last 3 years of our conference videos are available to our dues-paying members as well, so they can get a lot of education on that. But then also just for the general public, I encourage you to follow us on our social media accounts for lots of good information, for rapid response to things that are happening in the news. If you wonder, they're saying that this woman needed an abortion and she couldn't get one. Is that really true? Oftentimes we're doing responses to those kinds of things. So you can find us on Instagram, on Facebook, on X, on LinkedIn, and I do not have a TikTok account, but APLOG now has a TikTok account. So you can also find us on TikTok. So we're on all the major social media platforms. We're on YouTube as well. We have a weekly podcast as well called Observations, Conversations on Women's Health. And so that's available on all the major podcast platforms, and new episodes come out on that every Thursday. So lots of ways to follow us.
Awesome. Well, lastly, did you have a Bible verse that you wanted to share with our listeners before we hop off?
I do. And the funny thing is, I had a different verse picked out, actually, knowing we were going to do this. And then this morning, I was reading and came across a different verse. And I was like, actually, I think that this is very apropos to what I know you guys are dealing with in New Hampshire, but also what we're dealing with in the medical profession. So I was reading in Habakkuk, actually, not a book that I'm used to quoting scripture out of. But as the book wrapped up at the end of the 3rd chapter, and it's verses 17 through 19, and this is showing my age. I don't have my reading glasses on, so hopefully I get this right. It says, though the fig tree should not blossom, and though there be no fruit on the vines, though the yield of the olive should fail, and the fields produce no food, though the flock should be cut off from the fold, and there be no cattle in the stalls, yet I will exult in the Lord. I will rejoice in the God of my salvation. The Lord God is my strength, and he has made my feet like hinds' feet, and makes me walk on my high places. And that just really stuck out to me because, I think especially since the Dobbs decision, the pro-life movement, I think, has felt it was such an amazing victory, right, to get Roe overturned. And some really great things happened, but we've also had some really disappointing setbacks. And so it can be really easy to become discouraged. And as we try to change hearts and minds, which sometimes have felt like they've swayed a little bit in the other direction since the Dobbs decision, it can be really easy to feel like, Lord, where are you in all of this? And it can be really easy, I think, to feel defeated and tired. But thankfully he is good. And he reassures us that even when there's no glimmer of hope that we can see sort of on the earth, of course, we always have hope in him. And he has promised to make our feet like hinds feet, meaning planting them firm so that we cannot be moved and cannot be shaken. But also, I think he's very good to us in that he gives us those little glimmers of hope to keep us going and to give us a glimpse of that glory that is to come eventually. So hopefully I know it starts out a little bit depressing, but hopefully that encourages people like it did me this morning of even in the really tough times, we have the promise that he gives us that he will never leave us or forsake us and that he is our strength. And so I thought that was just a good
that was a great verse. That was, and something different too. We hear a lot of the same verses on here.
I wrote that down
it's nice
too.
to have something different.
Yeah. Amazing. Yes.
Yes. So
wow.
Yes, we do pray that for Apog that God would be your strength, make your feet like the deer's, and make you tread on high places. So
thank you so much. Thank you. I greatly appreciate it.
Yeah. For all people, for all parents.
Thank you so much,
mothers.
Dr. Francis, for coming on the show. And thank you for everything that you're doing for life. And really just the knowledge and education that you're, putting out there for the general public and for the medical community. And it's super necessary, especially in
and thank you for your friend
world. So we'll be praying for you.
That's right. Absolutely. I know. Thank you to Amanda for kicking my butt when it needed to be kicked. No, that's right. So,
all right.
Yes.
So awesome.
Well, thank you for all that you guys are doing to continue to be a light in New Hampshire. So thank you for that.
Awesome. Thank you. All right. Well, enjoy your weekend. Have a good weekend.
Thank you. You guys too. All right.
Bye, everyone.
Bye.
Thank you for listening to the Ever Living podcast, a podcast by New Hampshire Right to Life, New Hampshire's oldest and most active pro-life organization. You can learn more about our work and learn how to get involved at www.nhrtl.org. If you would like to donate to our mission, you can make a donation at www.nhrtl.org/donate. See you next week. May God bless you and be very near to you, and may you be ever living.